the Roots of the Science podcast with your girl, Anne with an E.
Hello, everyone, and welcome back to another episode of the Root of the Science podcast with your girl, Anne with an E. If you are new here, welcome. It's always such a pleasure having new listeners of the show. And of course, if you're a regular, thank you so much for returning. Usual reminder to follow this podcast on wherever you listen to your podcast, and make sure to hit the notification button so that you're well aware that a new episode has loaded. We are also on social media such as Instagram, Twitter, and TikTok at The Root of the Star Pod. We are on LinkedIn, Facebook, and of course YouTube at The Root of the Science podcast. And also, if you think you should be on the show, or you know somebody who I should chat to, please feel free to send me a message on the various social media platforms, or send an email directly at rootofthestarpod@gmail.com. Now, let's get into today's episode. Maternal health in African countries is still a significant concern due to high rates of maternal mortality. Despite progress being made in recent years, Africa still faces numerous challenges in ensuring the well-being of pregnant women and new mothers. To address these challenges, experts in this field are suggesting an incorporation of indigenous knowledge, collaboration between midwives and traditional birth attendants, otherwise known as TBAs, and prioritizing women's opinions in maternal health initiatives. Our guest today for STEM Solution Stories is Dr. Maurine Musie. Dr. Maurine is an advanced midwife specialist and midwifery lecturer at the University of Pretoria in South Africa. She is the youngest PhD holder in the nursing department at the same university. Dr. Maurine will help us understand the possible outcomes of indigenous knowledge and collaboration with traditional birth attendants in maternity care. Tune in for all of this and so much more on STEM Solution Stories, where solutions become stories. Let's go. Good morning, Dr. Maurine. Welcome to the show.
Thank you and good morning.
It is such a pleasure to have you on the show with us this morning. So before we get things started, can you just give us a brief background on who you are and just briefly what you do?
Okay. I am Dr. Maurine Musie. Currently the youngest PhD holder at the University of Pretoria, and also the youngest woman in science. I'm currently a midwife specialist and also a midwifery lecturer at the University of Pretoria. I'm teaching your third-year students your midwifery, maternal and child health care. And yeah, that is me.
Amazing. And what wonderful achievements. Congratulations for all of those achievements. It's something to really, really be proud of. And speaking about you being the youngest PhD holder at the university in your department of nursing at the University of Pretoria, and also the youngest woman in science, I think let's start from the beginning. What motivated you to advance so quickly in your particular profession?
Thank you for that. I think what motivated me to progress so fast is that I had clear goals in mind that by the end of this year or by 2023, I would like to have finished my research, which was my PhD study. So I think that helped me focus to really progress in my studies by having the clear goal sets. And I should say that it was not easy. It was challenging because I started my PhD journey during the COVID times, in 2020, when there was the hard lockdown restrictions. However, with so many hurdles or challenges that I encountered during my journey, I really had my goals in mind that by the end of, in 2023, I would like to have completed my study. So that really motivated me. And also being afforded the opportunity, like having a research grant from the National Research Foundation. It was called the Black Academic Advancement Program, which is BAP. they clearly indicate that you need to do your PhD study in 3 years, which is the record time to finish your PhD. So also from the research grant as well, having that in mind, it really assisted or propelled me to really progress that quickly. And also having a support and mentorship, from experienced professors like my supervisor, Professor Mavis Mulawizi. She really significantly impacted on my progress because she really kept on pushing me and reminding me about the goal that I had in mind. And I should say, I also have a personal drive and a good work ethic to really advance in my career. So I think that is what really pushed me, and the passion that I have for midwifery really assisted me to progress that quickly.
Fantastic. And speaking on your area of specialization, you did mention that you are an advanced midwife specialist. So what does this mean for somebody who is like, okay, you are this amazing person who is advancing, but what does that mean? What exactly do you do? And what is in terms of your specialization?
Okay, so in nursing, you get to complete your 4-year degree, and then you get your bachelor's degree in nursing. So after that, I went further in my studies and went and did an advanced diploma in advanced midwifery, meaning that I specialized in advanced midwifery, meaning that I now deal with cases that are more high risk. I'm able to manage more complex and more obstetric complications and emergencies. So I'm more capacitated to deal with those emergencies because I have specialized. I've went further in terms of my training. So normally you can do it at a college or at any university, but I did it at the university where I did it at the same time with my master's. So I got the master's in terms of the research, and then I also completed the clinical or the advanced midwifery, which is a postgraduate diploma that you get to do to advance your studies. Yeah.
Oh, wow. My mom is actually a midwife. So,
yes.
So this is pretty special to my heart. And when I told her that you're on the show, she was really excited. So, you are inspiring, really amazing people. So, in terms of maternal health care, you are an expert. Like you said, you've advanced. Some people stop at a 4-year degree, but you have advanced and you've become an expert in your field. So in Africa, from your expert opinion, how worried should we be about the maternal health care in our continent as a whole? And why is it so important that you decided this is your area of focus?
I think that I just knew it from my undergraduate study that I really want to work with the mother and the child. Like having to see at the end of, after assisted the woman during the delivery and all, seeing an alive mother and alive baby at the end really gave me, it was what I saw that this is what I was born to do. So I think in terms of maternal health, we need to know that it is a critical issue in Africa because we're not only dealing with the mother only, we're also dealing with the child as well. So in Africa, I should say that there are so many several challenges and disparities that we can see in terms of maternal health. And as a midwife and a midwifery lecturer, what propelled me to actually look into, the study that I did is that when I was still working in clinical practice, so I worked in one of the hospitals in Tshwane. I worked for like 3 to 4 years. During my service, I found that a lot of pregnant women utilize, both streams of care. They go privately to a traditional health practitioner or a traditional birth attendant and also come to our Western healthcare facilities. And you find them coming to the ward, carrying a bottle with a mixture or, herbal concoction called isihlambezo to the hospital. And we as midwives, we know that isihlambezo is known to precipitate labor and which can even end up, causing a lot of complications during labor. So I really found that we really need to look at maternal health and know that women do seek both streams of care. So what we really need to look at is that currently, in South Africa, as a whole, we're experiencing a very high rate of maternal mortality. Some of the mortalities can be linked to factors such as limited access to quality healthcare and also inadequate obstetric care and socioeconomic disparities. So you find a lot of women, they are women who still, believe in your traditional values, cultures, and you find that they delay seeking your healthcare facilities, due to certain cultural beliefs. So I really think that it's very important not to turn a blind eye to the fact that they also do consult other forms of healthcare. And other problems that we're experiencing in maternal health is also access to healthcare. My study was actually done in places like Mabopane, Soshanguve, where you found that a lot of women were not had limited access to those facilities. And sometimes they only come to labor, maybe they even deliver at home, what we call born before arrival, BBA, just because of certain cultural beliefs that are associated with pregnancy. So we really need to look at that in totality. We have a holistic view of how our maternal healthcare system is currently situated. We have women who have social and cultural, the social and cultural factors that really impede a woman from seeking healthcare, being afraid of being bewitched, things like that, which really affect them and affect the decision making that they make around pregnancy and childbirth. So I should say that in terms of maternal healthcare system, there are so many challenges that we are experiencing that really requires a multifaceted approach. We cannot turn a blind eye and think that they are not consulting traditional birth attendants or your traditional healthcare practitioners. They are. We live in a society where women have pluralistic health needs, where they can consult both. However, these systems are not working together. Somehow, there is no recognition of the other. And we know that the current dominating system is the Western healthcare system. However, it means that if we don't go in depth and find out if they go to a traditional birth attendant, what is it that gets to be done there? And look at maybe if there are things that we need to correct in terms of their practices, because we hear a lot of, news that say that traditional birth attendants or traditional healthcare practitioners, most of their work or their practices is associated, with negative outcomes. But we really need to go and look into that and to find out if really it is associated with negative outcomes, and then what do we do about it? Because we can't just say that their practices is associated with negative outcomes and also contributes to our maternal mortality rates. So this is what really assisted me to go forth and go and look at, is there something that they are doing which is good for maternal health, and what they're doing which is not good for maternal health, and find ways to, sort of bridge that gap.
Amazing. And I like what you said about that it's such a complex issue. It's not just black and white. There's the issues of accessibility. There's the societal aspects, there's the fact that maybe she might want to go, but maybe her husband does not believe in it, or her family. So it's very multi-layered, and I think it's so wonderful that you are looking at that intersection. So in terms of your research, have you come across any innovative approaches, or rather interventions, that you were able to successfully integrate this traditional practices? Because I think in some elements they do have their spaces, right, as well as the modern healthcare systems, and in order to help improve the maternal health outcomes.
from the findings of my study, we ended up having what we call a nominal group technique, where there were various multiple stakeholders that were involved. People from the Department of Health, people from the Directorate of Traditional Health Medicine, where we sat, in sort of like a round table to discuss what are that we can collaborate, what are the ways that we can integrate them into our healthcare system. And we found that it is something that is still, beyond reach. But however, it was proposed that we can maybe start looking at maybe including them in sort of like an inclusive framework of collaboration. This is where we recognize that they are there.
Yes.
But not to say that we are working hand in hand, but the Western healthcare system recognize that THPs, which include traditional healthcare practitioners, your traditional birth attendants, your herbalists, we recognize that they are there in our communities where the very women reside. We recognize that they are there. However, what can we do to sort of like empower them? So we thought of maybe we can have what we call capacity building for them, just to train them on certain aspects that we really think that is very crucial in terms of our maternal healthcare system. Like, we want them to be able to recognize that, no, this patient that I'm dealing with is a high-risk patient. There's dangers that are associated or risks that are associated in this woman's pregnancies. Like, for an example, they get somebody who is presenting with hypertension, for an example. They do not keep such a patient with them, but recognize and refer, because these women, they trust your traditional birth attendant. So they would really listen to the education that they're giving them. So recognizing those danger signs and then referring them to our clinics. And we're urging with our clinics not to turn them back, because you find that at the clinics, the nurses will be saying, no, if you consulted other forms of healthcare, they would want to turn them. So we were urging to saying that this is how we can really recognize them, because sort of like having a fully integrated system is still something that is difficult to say. Then how do we say they can be integrated into our healthcare system? So what we're doing as a university is that we have introduced what we call transdisciplinary module, where when a student is, in whatever, like we normally do it in all the year groups, first year all the way up to fourth year, they have a module where we call in our traditional health practitioners, our indigenous knowledge holders, our traditional birth attendants, where they come to the university, they share, with our students, what are the practices that they are doing. And we also have days where we take them for site visits, places like in Mamelodi, where they go and actually go and see that when a herbalist or a traditional birth attendant is consulting with a patient, what is it that they are doing in their Indumba, which is their sacred healing huts, where they consult with the patients. We also developed a project where, as I was saying, talking about capacity building, where we are training our traditional health practitioners and TBAs on issues such as, CPR and first aid. So those were some of the things that we indicated, and saw that if we can also train them on such issues, then it can also assist. And then currently I'm working with the National Department of Health, where we saw that the traditional birth attendants are in the community, they are residing in the community, they do see the woman during her pregnancy. So in that guidelines, we want to develop your community guidelines, where in those guidelines, I have to clearly indicate what is the role of a traditional birth attendant in terms of assisting the woman during her pregnancy, labor, and childbirth. What is their scope of practice? What is it that they will be expected, to do when they are managing or working or assisting a pregnant woman? And that we're moving towards what we call your NHI, which is your National Health Insurance, where we thought of maybe if they can get, like extended roles, like things like they can be a doula or a birth companion, where they are allowed to after they've seen a woman, they've seen that there are dangers, and then they come with the woman to the clinic, and sort of accompanying the women to the facility. Those are some of the ways we thought that maybe we can integrate them. We thought that they can be integrated at an antenatal level, so where the woman is still pregnant. However, for issues such as labor, we thought that, with labor, there are so many complications, and we can't be having women that are not giving birth in facilities where there's access, to your theaters, where if there can be an emergency that can arise. So we're still talking about skilled birth attendants, looking at the safe motherhood. We really still advocating that women should give birth in a facility where there's access to those emergency services. So we thought that birth attendants can assist us maybe at an antenatal level and also at a postnatal level. So postnatal, this is after the woman has given birth. They can do things like your home visits. In the community now, we have our WOBOT or our community healthcare workers. So because they are also trusted in the community, they can assist us, with our postnatal visits, giving the health education to the women, encouraging breastfeeding, things like that. So those were some of the ways that we thought of integrating them into our healthcare system. Yeah.
Fantastic work that you're doing. You mentioned about capacity building with the traditional birth givers, for example. But I wanted to ask you, on the other hand, what is the role of the indigenous knowledge that maybe you as the medical practitioners have learned during that process? Because I think you touched a lot on how you have equipped them and you are equipping them, but there's also that indigenous knowledge. Has there been, what is that? What are some things that you've learned? Because I think it's also very important to talk about that indigenous knowledge aspect.
Yeah, definitely. Yeah, I really, from the traditional birth attendants that we interviewed, we also saw that we can't say now that the Western healthcare system is sort of superior to the traditional healthcare system, because there are so many things that we can learn, from our traditional birth attendants, which I also learned during the study that I was doing, is that, we are African, and there are some conditions, there are some conditions, some traditional conditions, such as rigoni or ibala, that when a neonate, has that reddish sort of like mark behind the on the head. In Western healthcare system, we can't explain that. We always confuse it, with meningitis, things like that. But whereas it is like a sacred traditional condition that the neonate is presenting with. So I actually learned that there are conditions where we really do not have an answer in terms of Western healthcare system, where the traditional birth attendants, they can really assist us in such cases. What I also learned from them is that, nowadays there are so many issues that women are facing, in terms of their reproductive, there's a lot of cases where we're finding a lot of women having infertility issues. What I found out, from my studies, that some of the infertility is not, it can't be answered medically. You'd be giving the woman the hormones, she'll be going to the fertility clinic, whereas this infertility actually, is actually associated to traditional customs or traditional causes that could have contributed to that. So they can really assist us in such cases as well, where we really can't find an answer, to such sacred conditions. Then they can really assist us in those ways. And, I think also during the COVID, we learned a lot, about traditional health and traditional medicine. I think all of us, during the COVID, we wanted what we call lingana. Lingana, all of us now wanted to, prepare that just to prevent
Yes.
ourselves, from getting the COVID, the flu. So there's really so many things that we can learn from traditional health. And, in Western health, we use those herbal medicines or those herbal plants, and we prepare them in our Western way, and without really acknowledging that it's coming from them.
Yeah.
Such practices are coming from them, so we do go to them, we do research, things like that, and we really don't give them, the honor or the gratitude that they are supposed to get in this process. So I really learned that there's so many talks that they are associated, with harmful, but others really, they are doing good practices, and there are conditions where they can really assist us, as I was saying. So I think those are some of the things that I learned during this journey.
Interesting.
Yes.
I've also learned some things, and you're right that I think we do not honor indigenous knowledge enough in terms of the role that it plays in Western medicine. But when we were at a crunch time during COVID, we all quickly remembered that. So I like the idea that even with this, with your study and with the approach, the idea of the transdisciplinary approach, taking in multiple stakeholders, including the people in the community is very, very important. Just one last question as we wrap up. What best practices do you want to see in future among midwives in Africa or South Africa's to be more localized, that you believe are essential in enhancing maternal health?
So the best practices that I really think is very important is that there are so many, right now I'm busy with another study that I'm currently, embarked on, where I'm now advocating for what we call respectful maternity care. So what I've noted is that there is so many mistreatment, and there's so many, obstetric violence that women are succumbed to, in our facilities, where, for instance, they are not, you find that a woman is in pain, she's feeling those labor pains, and then you would find maybe a nurse saying that labor is supposed to be painful, whereas that is not the case. There is pain that is really bearable, and there is pain where you can see that the woman is no longer being able to bear this labor pain. So I'm really looking into, and I would say that the best practices would be, looking at respectful maternity care, respect the woman, and also respect the decisions that she makes in terms of her, allow her to have autonomy, allow her to make decision making in terms of her birthing process. So that is very important. And I'm also in terms of our practice as midwives, we are governed by what we call better birth initiatives, where we really want to make sure that whatever practice that we are doing is really for the benefit of the woman, and also for the child as well. Looking at also patient-centered care. So let us treat the woman, as an individual, because all women have, unique needs. So really promoting a patient-centered care, I think, is also very important. And I would also want to say to midwives to also apply, evidence-based care, because during the theory, we teach them the different evidence-based practices that needs to be done, in order to ensure, positive outcomes for the women. So what I also did in terms of my master's, I found that, midwives just follow what is done. They do what is done in Rome, where they just put the women on the dorsal supine position, which is, in terms of my study and in terms of evidence, it says that the woman should be allowed to adopt any various birthing position that she wants to adopt, because it comes to her naturally, to really change and change position. So that is very important to make sure that the practice that we are doing as midwife is evidence-based and is for the good of the mother and the baby. And also, I want us as midwives to enhance our antenatal education. It's very important that we teach our women, what to expect during their pregnancy, what to expect during their labor, because it doesn't really, we can't say if a woman is not in her first pregnancy, then we won't share with her or won't educate her. It's very important that we educate at whatever chance we get. Let us educate our women, because of when we're offering comprehensive education to the women, they really get to be informed and they know what is happening in terms of their pregnancy and also their birth as well. And one of the things that I wish we could adopt, in South Africa is what we call continuity of care. Where it is done, internationally, where you find that a midwife really takes care of the woman, throughout her all stages, of labor, stages of care, from the antenatal all the way to labor and all the way up to postnatal. Currently, our system is a bit, fragmented. She goes to the clinic for antenatal, comes to the hospital to give birth. Postnatally, we're discharging her back to the clinics. So if really we could look at continuity of care, then I would think that would be, best to ensure that we have good and positive outcomes for our women and help reduce your maternal mortality, and therefore also contributing to our sustainable developmental goals. So I think those are some of the best practices that we as midwives should continue and to really enhance and follow those practices. Then we will achieve good and positive maternal outcomes.
Yeah, for sure. I mean, you've raised so many important points, and I think we still have a long way to go as a continent. And I hope that some of these points that you've raised, you through your research and the other researchers and other stakeholders who are involved, the change and the solutions can be implemented, because you'd want somebody, childbirth or giving birth or giving life should be ultimately a really wonderful experience. And it's a pity that some people do not experience that due to things that could be avoided. So thank you so much, Dr. Maurine, for chatting with me today. It was amazing hearing about the work that you do. I learned so much, and I'm sure everybody else learned so much. And to everybody else who's tuned in, thank you for listening to another episode of the Root of the Science podcast with your girl, Anne with an E. Until next time, goodbye.